Well, welcome to our second panel, and it's lessons from the California and San Francisco soda tax and labeling campaigns. So just like in the fight against cigarettes, taxes and labeling legislation has played a huge role in the public debate around government and corporate responsibility around the obesity epidemic. So I'd like to welcome our panelists who are all active in pushing forward legislation that will either tax or label sugary beverages. We have Supervisor Scott Wiener, San Francisco Board of Supervisors for District 8, and co-author of Prop E, the latest soda tax in San Francisco. We have Elizabeth Belton, the State and National Policy Coordinator at California Center for Public Health Advocacy, and Dr. Kirsten Vivens Domingo, Professor and Researcher at UCSF and Director of UCSF's Center for Vulnerable Populations. So my first question is for Dr. Vivens Domingo, and that is, what are the projected health benefits of a soda tax?
Sure. Does this work? Yes. Hi, everyone. Our group has been really interested in looking at, on a population level, what would be the health benefits. And so the way we thought about this was three ways. One, we knew from the economic literature that if you take a tax of about a penny per ounce, that would probably reduce consumption of sugary beverages by about 10 to 20% if you look over the population. We then took the best available evidence from the nutrition literature, from the epidemiology literature, which suggested that soda consumption is linked directly to diabetes risk. And even that happens even independent of its effects on weight gain. So that if we could reduce consumption, we'd probably prevent some cases of diabetes. We know that diabetes is linked to heart disease. We know that sugary beverage consumption is linked directly to elevations in blood pressure. And so those were the types of health inputs we put into our model. And when we churned all of this out across the US population, what we found was that a penny per ounce tax would result in about 250,000 fewer cases of diabetes a year. And then the downstream effects of that are additional benefits in terms of heart disease cases avoided. I would say the interesting thing about the way the modeling came up for us was that the health benefits and the projected health savings from these cases that are avoided were even bigger than the amount of money we thought we would generate from the tax revenue itself. So that was really substantial and surprising to us. And then when we modeled this for California, the impact for poor and minority communities in terms of health benefits were proportionately greater because the diabetes risk is greater in those communities.
Great, thank you. And Elizabeth, what parallels do you see between the fight for soda regulation and the fight for tobacco regulations?
I think it's a really great question. The first thing that jumps to mind is the time span differences between the two struggles. So the tobacco fight has had over 60 years to make the dent in tobacco consumption, whereas the sugar sweetened beverage reduction fight is really in its nascent, so it's like only 12 years old. And it's really been on the forefront in California. The tobacco fight has a lot of lessons for those of us working in the sugary beverage regulation world. It started in the 50s with some concerns over health problems. In the 60s, we saw the Surgeon General's report and the very first labels put on cigarette packages. It wasn't until the 80s that we saw significant federal taxes placed on them. And what we saw in terms of effects on consumption was that concerns alone did not affect consumption. The labels started the first leveling of consumption and some reductions, and then the taxes ended up helping a lot. And then we've had a lot of work that's come since even 1998 when there was a big settlement with tobacco that put a lot of money into education and into environmental change. So it's sort of seen a gradual tapering, and I think it's actually been a huge success in the public health world. I mean, it's really one of the things we hold up the most. It's something like 8 million lives have been saved since the labeling of tobacco from tobacco-related deaths. So I think there's some great lessons there for us. As I mentioned, the sugar sweetened beverage fight is really young. It's only about 12 years old, so this was in 2003 that California took sugary drinks out of schools. We started with schools and sort of food standards and school foods and taking sugary drinks out. We've tried some local soda taxes. That also came from tobacco lessons that we learned, that local ordinances, cities and counties enacting legislation first, then states jumping in, and then the federal government tends to follow behind. So those are also some sort of methodological lessons that we've learned from tobacco. But I think it's it's really important to remember that it was a long fight. The beverage industry has a lot of similarities to the tobacco industry. I think the more that we draw comparisons between the two industries, the better for changing social norms about consumption. But I think that there are some big differences that you run up against too. People really feel like there's no healthy level of tobacco consumption, but there's a healthy level of consumption of sugary drinks, that it's a food. I mean, you saw these arguments come up even in the San Francisco soda tax effort, that it's somehow a cost of living issue. So it's not quite seen the same as alcohol and tobacco. So we have some work to do, but I think that we're headed in the right direction, and we have a lot to learn from tobacco. I don't think there's going to be a smoking gun like there was in tobacco in terms of a paper trail of an industry who knowingly did stuff to people. So I don't think that's going to be quite the same thing. The beverage industry has learned a lot from the tobacco industry's faults. So it's a real uphill battle, but I think we need to be positive and see we've seen some effects on consumption already with the policies we've been attacking, and I think we've got a good way to go, but I think we're headed in the right direction.
Great. This is a more general question for everyone, but what are some of the greatest misunderstandings by voters about these taxes and legislations?
Hi, everyone. I can speak really from the San Francisco Proposition E experience, where we fought a great fight, and we had $10 million, just a tidal wave of corporate money, come against us, spreading enormous amounts of misinformation. And despite that, we got 56% of the vote, not the 2/3 we needed. And actually, when you look at the map of how it did in different neighborhoods, it was amazing that Berkeley got 75% of the vote. We were really thrilled for Berkeley, and they really wanted to broke through the barrier. We were also, these were the first two that actually got even close to 50%, let alone over 50%. And if you look at the neighborhoods in San Francisco that demographically look like Berkeley, Valley, Churro Hill, Marina, Coal Valley, and so forth, we got over 70% of the vote. And that really shows us, I think, one of the big misconceptions, that this is somehow, it's regressive. That it's regressive and it's going to disproportionately harm low-income people and communities of color if you make it less super subsidized cheap to buy sugary beverages. And of course, we know that what's dramatically more regressive than a penny or 2 pennies per fluid ounce of soda, what's more regressive is when you look at the maps of where diabetes hospitalizations are happening, and it's not in the Marina or Coal Valley or Noe Valley, it's in our lowest income neighborhoods. And that's why, even though we have a lot of work to do in terms of building the diverse coalition that we need to really make change here, we were seeing at least that maybe it didn't go down to the grassroots yet, in terms of leadership in communities of color in San Francisco, were overwhelmingly on the yes side. African American ministers, folks who are doing work in the mission and other areas with large communities of color doing that kind of work, people get it. And so I think that was the biggest misconception. It was a really simple argument in the soda industry.
Yes, I agree with most of these things, and I think it can't. You should be have to say it clearly and loudly that the soda companies actually want you to believe that these are regressive taxes. They want communities of color to take on soda tax as somehow a right, and they're very. You have to watch these campaigns and see how cynical the messaging is. If you look in New York and co-opting the NAACP and making soda a civil right, I mean, it's really challenging. I think this is really about building strong and deep partnerships with these communities, and not having the soda tax be about targeting people and victims and blaming and things like that usually lots of our language and our rhetoric about food and obesity and disease and everything is. This is really about a chance to right the playing field, because sodas are things that are kept artificially low compared to this consumer price index. lots of other things that we want people to be eating are held higher than the consumer price index. And having communities really understand this is about generating revenue that can help in the fight against chronic diseases, and actually shifting those incentives to incent health in communities that are disproportionately affected by diabetes in a way that is in fact truly regressive. I think that's the message that has to be out there, and is really the fundamental misconception in this entire debate.
If I could just add one thing. The other, I think, big misconception, which again was fed by the industry, and granted, I'm biased because I spent about a year and a half debating soda industry and got to hear all of them just want to explode in terms of some of the things that you hear them say. But one of their other big argument that I think did resonate with some people was, this just isn't going to work. Even if you think you want to do something to reduce sugar beverage consumption, this just won't work. They had all sorts of weird arguments about how the tax was just going to be spread to the cost of all food, so everything would become more expensive, which anyone who knows anything about retail pricing will tell you that's not true. And just over and over again, it's not going to work, it's not going to work, even though cigarette taxes have been one of the most effective public health or public policy interventions in the history of public health. And arguments that this isn't going to work, what you should do is just make sure to educate people. And they did that at the same time that they were fighting tooth and nail to kill the labeling bill in Sacramento. So it's just, again, a very cynical opposition.
Yeah, I totally agree with everything that's being said. I think the one thing I will say in addition is I think we have a little bit of work to do in their argument where they say we're picking on soda unnecessarily. And as an organization, my organization, we really feel like there's a very good reason we're going after sugar-sweetened beverages. But people don't understand the science always very well in that, and we have some work to do. That's in fact why the label bill makes so much sense for us to go after. The label actually allows us to talk about the science and why sugary drinks are particularly harmful. Not only are they the single biggest source of added sugar in the diet, but the fact that they're consumed in liquid form means that they spike blood sugar much faster than solid food. And that can be very harmful and very directly related to the diabetes problem. So there's some real reasons why soda should be picked on. And I think the general public doesn't quite always, hasn't got to the point where they really understand why. Is it just that people are drinking too much and they're empty calories, they're not good for you, they don't have enough, yes, all that's true. But there's some real good science out there about why these are related, particularly to diabetes. And so I think that's not it's a misconception that they say that they're being picked on unfairly, so I'll add that.
And going off of that, Elizabeth, with all these misunderstandings, what have you found to be the best tools to combat industry that might be trying to foster those misunderstandings?
People ask me that all the time, like, so you're going up against this industry that has incredibly deep pockets, some of the biggest, international companies in the world, and you're just, how do you do it? How do you win? How do we change it? You just get totally discouraged. And I said, well, the biggest thing we have on our side is the truth. And that ends up being what wins out legislators, is who my audience is in particular. If you present the truth in digestible format, in a way that people understand and resonates with them, so it has a kind of framing we heard talked about, this is about values of collectivism, we have to take care of people, this is about shared costs, we talked about healthcare costs, but the truth is a really big one. So I think my organization, we do some research, we look at consumption rates, we look at diabetes rates, we're looking at hospitalization rates from diabetes. And we found in California that 1 in 3 hospitalizations is a person with diabetes. That's huge. It adds costs to every single hospitalization. And then we've also done research into sort of health halo effect. So they've shifted people a little bit. We're starting to take people off of regular soda, and now teens and a lot of people are shifting towards things that have sort of a health halo or health washing effect where they think they're healthy. So a lot of sports drinks and different vitamin waters and things like that people think are healthy, and yet they're just sugary drinks. Pretty much the same thing, maybe slightly less sugar calories, but empty calories have a big problem nonetheless. Other things that are helpful, polling to help convince legislators to vote in certain ways. Expert testimony, thank you to Dr. Rubens Domingo and a lot of others who come to Sacramento and talk to legislators in hearings and in meetings, again, preaching the truth to people. Grassroots pressure, people making calls, sending in emails to their legislators at key times, so we have a network of people we draw on, and having their voices come from the ground up is a huge strength. It creates pressure on people to do the right thing when they are faced with the truth. And then the editorial support, newspaper support has been a huge tool in getting out the information we need to, having the right framing. With the label, we've had incredible editorial support, and that's been effective both in convincing legislators and educating the public about the problem.
If I could just add to that, I think that even though it might, when you're going up against a multi-billion-dollar industry, it may seem like, oh, you're saying just get the truth out and you'll win, and that seems, like good luck on that. But it's happening. And if you think just the last few years, the sea change that we've seen, and I think it is in part, not just because there have been sort of just a stream of studies coming out of UCSF and other institutions that, for a while, it's like every week there was a new study coming out linking sugary beverages to something really bad. And that has an impact, but also sparking these political points, having these, the San Francisco Berkeley measures. I could not believe how much press we're getting, not just the Bay Area, but around the country, around the world, national and international press. And that ends up eventually sinking in to the point where there was a particular foundation after the November election did some focus groups on sugary beverage issues in San Jose, which did not have soda tax. And they said that the people in that focus group, in those focus groups, could recite the arguments on both sides without being told anything. And we were not up on TV. The other side was on TV a lot. So they were getting it just from online, from the newspapers, and that's also another really important thing. Editorial boards, that wasn't, always there. When Richmond did its soda tax in 2012, the Chronicle repeatedly just went past it, made fun of it, just really shredded it apart. And so when we introduced ours, we took a full delegation to the Chronicle editorial board, doing Dr. Rubens Domingo, and we decided, and we were, I think, right, but when you start putting actual medical professionals in front of these editorial boards, you have the meeting out of the palm of your hand. I mean, they can tell a politician, you're full of it. You can't say that to a doctor. And we went back and we got the endorsement. We brought another great physician, Dean Schellinger, there, who, once again, we didn't even have to say very much. He just talked about the statistics. And so that kind of information is very powerful.
Supervisor Wiener, what groups and organizations in the fight for Prop E were key supporters that helped build momentum, but also which groups were the hardest to reach?
So I think whenever I would feel down during the campaign, because with all that money coming into it, it's hard, I would just go on our website and look at our endorsement list. I think the website is still up, so it's extraordinary. It was the entire health community, the entire education community, the entire parks community, so many labor unions. And so when we were able to say, once people would say, oh, it's not going to work, and the industry would say that, and say, wait, the California Medical Association, and the California Nurses Association, and the Hospital Council, and the California Dental Association, and the Community Clinics Consortium, and so on and so forth, are supporting it, and yet you're going to believe the soda industry when they say it's not going to work. And so having the united medical community behind us was absolutely essential, because again, you can't dispute the science. I will say that having parents involved, when we wanted to do a poll at the very beginning, before we wanted to just do a deep poll, we had to raise like $30,000, and the hospital council gave us some money, and we got some money from some other groups, and we were about $8,000 short. And so I called up a friend of mine who's involved in some of the public school parent groups in the city, and I said, could you maybe just get some parents who are interested in this to write a few checks to maybe we'll raise $1,000 from that. Within 48 hours, they had raised like the full amount. I mean, just like that. And we have an army of parents behind us, and the parents really gave us, having the PTA, having all of those groups behind us just had a huge impact.
And were there groups that were particularly hard to reach?
Were there groups that were, there were, I would say in some, in the Chinese community, and we had some real challenges going as deep as we wanted to go. We definitely had some community leaders and organizations that were very, very supportive and helpful, but we never penetrated to the extent that we wanted to. And we worked very, very hard, especially early on. We went to the Think Tal World Journal editorial boards. We met with different CBOs that were doing work in the community, and it was very, very hard to gain the level of penetration that we needed. So that was a big challenge. We also, labor was very split, which is better than Richmond, where labor, there's a lot of labor against. And we had a lot of labor support, but there were some unions that were not supportive and ended up creating a divided labor workforce.
I'll agree with that. So the Chamber of Commerce is always up against us. Businesses, the Grocers Association, and unions. We've had a lot of trouble with the unions. We've actually had quiet conversations with the union leaders, union lobbyists, who said that, like, look, we get it. We get these are a problem, but we are contracted to work with these companies, and they have told us that if we don't follow suit and be against, that we will lose contracts. So you're talking about a very strong industry and very persuasive. So the anti-job, the effective jobs argument is a tough one for some people.
Well, we did get a lot more labor support than in the past. SEIU supported us. The nurses were terrific and financially supported. One union that really, I was not expecting this, I went to UFCW, United Food and Commercial Workers. These are, Safeway, Walgreens, CVS. I went to meet with them, and I'm just going to sit there and I'm going to suck it up, and they're going to oppose this. And they not only endorsed it, but they let us use their office in the mission to organize volunteers. They had people who were out walking precincts for us. And I asked them at one point, I didn't first, but eventually I was talking to one and I said, just curious, why did you support this? I really wasn't expecting you to do that, given who your employers are. And the response was, our members are getting diabetes too. And so I think we're seeing a shift.
And Dr. Buenas-Domingo, what role do you see communities most affected playing in advocating for taxes and other labeling legislation going forward?
I think it's essential that communities often that are poor and minority communities are actually are really true and meaningful parts of how these types of policy initiatives go forward. That's often challenging, of course, to figure out because these things play themselves out differently in the different communities. But it's really essential. And I think that the most important thing when I talk to community groups is really to again highlight the problem of diabetes, but also to think, especially the taxation, that taxes are revenue generating instruments. It's there are very few times that we have the opportunity to generate revenue in order to put towards a health problem. And I think to the extent that we can mobilize communities around this, communities of color in particular, they're concerned about diabetes just as everyone else is. But if we don't make communities meaningful partners in this, it's too easy for the soda companies to co-opt them in some other way. Why? Because they have the money. So it's too easy to put them. Why do we have the soda? Why did this take so long to get sodas out of the school? Because the schools put money into all those things that schools can't fund. Why does the NAACP in New York, say that this is a bad idea? Because soda companies can write checks to these organizations, and so unless we think about how to bring how to use the taxation, the revenue generated in this to actually put back into these communities, to think about how do we make fruits and vegetables, which we also know are important for health, more affordable in those communities. How do we think about school lunch programs to make them more nutritious? How do we think about physical activity programs? And how do we involve, obviously, the community leaders in real and meaningful I know you heard about Youth Speaks from Youth Speaks earlier. That's one of the things we've really loved. A lot of times, I'm particularly interested in the health effects in minority communities where the diseases are starting earlier in life, and thinking about prevention has to start earlier in life. Thinking about our young people as ambassadors to really helping to get the message out. They're often the ones who are most attuned to this idea of these big companies telling us what to do, or that we don't in our communities have access to the things in the way they have in other places. And I think figuring out how to get both our sort of traditional allies in terms of policy, but also groups that we know can get galvanized in sort of taking this message so that it really is about the health of the communities and not about, another tax thing that's going to affect the corner stores, which is usually how it's framed and how it's going to hurt us.
And Supervisor Wiener, what were the biggest legislative obstacles for getting a soda tax passed through the Board of Supervisors?
Well, the way it works in California for local governments is we can't pass a tax. The city law has to go to the voters. And because we did what's called a special tax, where the funds from our tax were dedicated to nutrition, physical activity, health programs, we needed a 2/3 vote. But we needed a majority vote to get it onto the ballot from the board. I had to be pro on this. I thought early on, I said, we'll get a unanimous vote from the board. I may have a few colleagues who need, some extra work in terms of making sure that they have full information, but we'll eventually get to 11 out of 11. We ended up, it was a 6-4 vote to get out of the board. One colleague was absent that week, he was a co-sponsor, so it really would have been 7-4 had everyone been there. And it was a real challenge. There was a lot going on behind the scenes, just in terms of conversations, and I had a few colleagues who just had questions about it, and I think they started playing off of each other a little bit, and that's why we're all entitled to review on these things. I think we were pretty confident we were going to get out of the board because we had 6 co-sponsors and we had at least 6 votes. But it was, there was some pushback. We always see this, that if you put this on the ballot, it's going to mess up other ballot measures, and the transportation bond, renewal of the children's fund, and the public education enrichment fund. And so there's always this argument, if you put that on, it's going to draw in all of this toxic money, it's going to toxify everything, they're going to attack city government, and everything's going to lose. One of the good results here is that despite that $10 million, everything else other than the soda tax pretty much won. The transportation bond got higher than we thought it was going to get. Everything got higher than we thought, and so that was a good lesson for everyone.
And lastly, a question for everyone. There have been some really great campaigns around raising awareness around sugary beverages, like the new Open Truth campaign and the Bigger Picture campaign. And what do you think are the most effective communication strategies to reach voters, and how will that impact your work on sugary beverage legislation going forward?
Yeah. I think there have been some really amazing education campaigns, and it is pivotal that we have those campaigns out in the community to get what we need done in Sacramento. And I think also it's very important to bring along the community for a lot of these measures that require community votes as well. I think the youth message is really important, as we mentioned before, to convince people that this is a grassroots, ground up kind of thing and not being pushed upon them. So that's, and people just love it. I mean, they really love to see youth get fired up about something. And I think it's very, very powerful. It's really hard to do. I mean, it's really hard to say as a CBO that you're like, well, let's get some youth to get excited about this, because it turns out, even in California, teens drink a huge amount of sugar sweet beverages, and to convince them that this is something that they should rail against, and it is hard. That's one of their biggest segments, and the industry is incredibly effective with using celebrities and sports figures and music and things like that, popular music to sell these products. They really are incredibly strong. So you know, for us, the communications and strategies that work for us tend to be a little different because we work in Sacramento, but working with community partners really helps from the perspective of getting the community to come along.
So I would say we, in our center, have formed this partnership with Youth Speaks, which resulted in the bigger picture. That work predated the soda tax. So while it is completely true that it's, you know, we want youth and we'd love them to say this, the reality is that the bigger picture campaign started because we work with Youth Speaks, which is a youth empowerment group that uses spoken word, obviously, to help young people tell their stories. When the way we formed that partnership was we went to just to give them information about diabetes, and it turns out in these communities, all the young people we talked to had experience about diabetes. They had family members who this had happened to. They knew exactly what we were talking about, and so we didn't have to do much actually. We actually just gave them the information, and they came up with these great videos, which ended up being used as public service announcements in many areas. And so it is true that it's hard to form these partnerships. It's hard to figure out what resonates with different communities, with different age groups. But I do think that the experience is so pervasive, particularly in minority communities, that if you can tap into organizations and build trust early, that they can be, you can develop relationships that you have really powerful ambassadors to deliver these messages. And then I would just also say the most important thing is to be talking about this. The thing that impressed me most when Mayor Bloomberg's soda portions thing failed is he very clearly said the most important thing is that we just keep talking about this. And it sort of speaks to what you were saying, that this is a multi-decade process. Soda consumption in the U.S. is actually slowly going down. Not in all groups, not at all times, but it is. And that is with Berkeley passing legislation, right? And that's because we're all talking about it. And that is the important thing to know and to keep going when all of these things, they seem so hopeless. So.
I agree with all of that, but I will also add one additional strategy, which I think works and can work with cigarettes as well, and that is sometimes you have to be really visual and graphic. And so there are a couple of things you might remember. One is the video of the polar bear, the polar bear, and showing what happened. Because without some visualization, people are like, okay, yeah, there's a lot of sugar in there, maybe I'll gain some weight, yeah, I know it's not healthy. But those kind of really visual, graphic presentation, I think, does help. That makes a point. We also there was our Shape Up Coalition did a terrific campaign showing just the number of teaspoons of sugar in soda. So when people hear it during the campaign, one of the most effective things we can do is say, "Did you know that there are 10 teaspoons of sugar in every single 12-ounce can of soda?" Or 25 teaspoons of sugar in a 30-ounce label, and that makes people nauseous when they hear that. And so this ad campaign that showed that is very effective. There was, I don't know if it was the CEO of Kaiser or someone senior at Kaiser recently published a piece suggesting that the warning labels, instead of just being words about causing diabetes, etc., should actually have photos of like amputations and people going blind and dialysis and whatever else, because again, it's not just, oh yeah, you're going to get out of shape and gain a little weight, but there are these very, very graphic things that happen.
Yeah, and I'll say that we have obviously looked at what the research is about effectiveness of different kinds of labels when we went into doing it. And the tobacco labels with graphic images are not held up in court. So that's a big reason why we can't go that direction, but I would definitely agree with the research that has been looked at it. That's very effective. So other ad campaigns. I mean, I think it comes back to the last presentation. Dr. Lesser was talking about the sort of individual responsibility versus collective responsibility, and I think that we have to partner with big, broad educational campaigns. We need to move social norms, but we really need to focus on environmental change and systems change in order to create a world where the healthy default is the easy and the more affordable default. And so telling people about how they can make different changes in their diet is important, and it underlies all the work that we do. But it is really important that we work think about the policies that help support those decisions in our society.
Great. Thank you all. So we have time for some questions.
You have in the pink, I'm sorry, I'm sorry. What is your name?
I'm Kirsten.
Kirsten. I love what you were talking about, the children being the advocates. It's getting very popular about kids speaking to other children rather than us talking to them. And I'm on social media a lot, and I got a lot of people coming to me saying, "Would you have children that would provide content?" And so I'm concerned about children then being responsible for having to provide consistently content out there to the world. So still it's us helping the children disseminate. So exploring that whole avenue is important. We need to get the kids to speak up, but at the same time, kids are kids, and we need to let them have a childhood. So I think, how do we find that balance that they can do this?
Yeah, I think you're absolutely right. I think that's why I think for us, we've been really thrilled with how the bigger picture developed, and really because it was never about how do we create PSAs for the soda tax, or how do we do anything like that. It was all about if you're giving voice to the things that are important to you in this youth organization, why don't we also give content that allows you to give voice about health issues, right? That's how we approached it. We never said before or against soda. We never said any of that. But we said, look, and I think, I mean, this is we didn't also work directly with this group. We were working through an organization that knew how to essentially help give the youth in this organization voice to their own experience. But it's such a crucial thing, because it was amazing to us that we could go in there and get literally like a few sessions on diabetes and the causes of diabetes, and everyone has this experience. This was not hard. This was not pulling teeth. This was people talking about their own experience, about what it's like to go in a corner store and not see where the fruits and vegetables are. This was people talking about their neighborhoods, what their neighborhoods look like in terms of exercise and things like that. And so we didn't tell them what to say. This was really authentic voice. If you go to the website at biggerpicture.org, and so but it is, it's hard. You don't want to be exploiting for a particular purpose or anything like that. And but it is really powerful, I think, when you provide context.
First of all, thank you all for being here and sharing with us. My question is around diet soda, and I find that it sometimes gets overlooked in this conversation. But I'm wondering how that fits in, and what is your opinion about it? Probably a much larger discussion, but
I think we get it every time. I mean, it's great. Keep asking it as long as that question's out there. And I think it's an important question to answer. And our response tends to be, would I encourage people to drink diet drinks? Absolutely not. I think that people should drink water. I was actually just on the phone with my mother telling her people need to drink water and eat their calories. But is it a lesser evil? I think the research about the dangers of diet soda is nowhere near what the research science says about sugar-sweet beverages. With the label, we have to make a decision about which drinks to put the label on, and what we wanted to be was very conservative about what products we labeled as having a connection, and so we stuck to where the science is the strongest. As science develops about the issues with other products, we're very open to being very transparent with the public about what the realities are for those products. But if you look at the research science about the dangers of diet soda, it's just nowhere near what it is about the sugar-sweet beverages.
No, I think that's well said. I think I sort of work on my researcher hat where we want to generate new evidence, and we want to think about what are really the cutting edge questions. But when you go into a policy arena, I think you have to be in that realm of like, what's the biggest harm? What do we have the strongest amount of evidence for? And that's where we're sure clearly in the high consumption of added sugar in the diet with sodas is like 30 to 40% of added sugar these days comes from sodas. That's why they're And so it's like, you know, so you have to be in that realm of sort of big picture, lots of evidence, and I think that's why it's a target.
Yeah. Thank you.
So I want to thank you all for your leadership on this issue. It's a big issue. I'm very passionate about it myself. What would you recommend that people in this room do to help create those environments that make it less accessible, less affordable, etc.?
I would say get involved. Look for those opportunities. Go to the website for my organization, the California Center for Public Health Advocacy. We are constantly needing that grassroots support, that pressure on legislators to do the right thing, to vote in the right way, to support this because we're up against a big industry. Become an advocate. So when we talk about communications, I think about my layers of who my targets are. Legislators are my number one target, my advocates are my second level target, and the general population is the third. So if I hit the general public, that's fantastic. We need to educate them. But advocates can really move the legislators. And they do that through making calls. Are you a doctor? Can you call up your legislator and say something? Are you an RD? Are you a nurse? Are you just a concerned parent? Those calls matter. They really do check them off if you call your capital office or your legislator when they're up against a vote and they feel that pressure. Write letters to the editor in response to articles and things that you see in your newspaper. People don't think, they go, oh, I read that in the newspaper. Write a response. It's very easy. It's 500 words or less to respond to an article. The beverage industry is putting out editorials left and right, spreading misinformation and combating us. So hearing from the public is very important. And then I think getting involved in schools and with children and talking to children from a very early age is really important.
So you guys talked about how the beverage industries have so much money, and I think there's a fear that they may try to quash the effects of the bill in Berkeley simply by lowering the price before the excise tax and eating those costs. Do you think they may try to do this? And if they do, and it's potentially successful, do you think that may have an effect on in limiting future efforts to reduce soda consumption?
Well, first off, I imagine they're going to file a lawsuit in every way they can to prevent it from going into effect. But that is exactly why, whatever happens in Berkeley, why we need to be trying this everywhere. We should be, cities and towns across the U.S. should be doing this. Let's make them fight on a many different front battle. We should be pushing it over and over again in state legislatures. Even though you might lose 10 years in a row, maybe in year 11 you get it through. And we need to keep, Congress will not be totally insane forever. Congress will eventually, things have a way of shifting back, and we will eventually have a Congress that actually believes in doing things to move forward the public health and welfare. And we need to, for example, push to eliminate the high fructose corn syrup subsidy. That is maybe one of the most important things that we could do in order to stop these drinks from being artificially cheap. And so we just need to be doing everything all over the place. So even if, you're right, if Berkeley's standing there all by itself forever and ever, they're going to be able to, just write it off or find a way to potentially manipulate it. But we have to just make them fight it everywhere. And I would say, watch the news on Tuesday because my colleagues and I, we've been working with Harold Fuller. We're going to be announcing some stuff on Tuesday to make clear that the fight in San Francisco isn't over. We're not announcing on the soda tax on Tuesday, but some other things that you should pay attention to.
Yeah, I'll say that. And there are different policies out there besides soda taxes too that people are looking at, the defaults on children's meals, what the beverages, the defaults. So Davis, the city of Davis was just taking that on, trying to make the default either water or milk. Some places are considering charging extra, requiring that they charge extra for anything other than those options on children's meals. There are different policy options out there. I would say, to the question about what can people do, talk to your city council person, talk to your very local about out they can put something forward on one of these issues, because it is really easier to move things locally than it is on the on the state level, let alone on the federal level. And yet those trends do cascade. And there are a lot of cities who talk to us about a real need to raise revenue in the state of California. And a soda tax is on the minds of a lot of different people, and they hear from their constituents that they want it, that it makes sense. That's a powerful thing. So, yeah, so get out there and talk to people.
Great, thank you all so much.